How are you doing today?
Okay, good.
Good. Do you mind if we make this video and then post it so other people can see it?
No, that's fine.
Okay. So I want to just briefly talk to you and have you explain to others that we're 9 months since your surgery. And prior to surgery, you had both back pain and leg pain.
Yes.
Was it bad?
Yes.
How bad?
I mean, it was continual. It was all the time. I had numbness in the leg that would come and go. So it was bad.
So, in addition to that, you were curved, scoliosis. You had one vertebra slip forward on the other. There wasn't enough room for your nerves, called spinal stenosis. You had back pain and leg pain. And the reason I want to do this conversation with you is because I want to show other people what we did and how you're doing. People believe that if you have a spinal fusion, that you can never bend again, right?
Right.
And that's a justifiable thing to think. But really, a lot of the motion that occurs when we're bending forward occurs between the ball and socket joint of the hip. So there are many people who are fairly flexible around their hips, and we could fuse their entire spine and still have them bend over in a very near normal, useful way.
Okay.
So we're just going to take a look at you.
Okay.
And if you don't mind, maybe you could stand right over here.
Okay.
And go ahead and stand with your side against the wall. Let's go this way.
Okay.
And turn sideways. Okay, so you're standing beautifully straight. Can you bend over like you're going to touch your toes? Come on back up. Now can you arch your back a little bit? Good. Now turn and face us. This way? Yeah. Can you lean a little bit to your right? And lean a little bit to your left. All right. Now let's surprise people and show them what your x-ray looks like.
Okay.
Come on over here. So she had a pretty severe scoliosis, which means that she has a curvature to the side. And we have fused her spine from L2, 3, 4, 5, S1. And there are cages between the vertebra and the discs. And we've put in rods and screws. And in an adult, we can never completely get the spine perfectly straight, nor do we need to. But this is a very straight spine for what she had. This is the disc and where the cage was placed, here, here, here. And this cage is down at the bottom and came in from the back. And we've put rods and screws in, and we've maintained a nice curvature in the lower back, which is what we call lordosis. So we fused 1, 2, 3, 4 levels. And I think the interesting thing about this lady is that she still has a very excellent functional range of motion. So one of the things that people ask me is, will I have less motion? And of course we think most people would.
Right.
But one of the interesting things is that the reason people don't bend or move is because of pain and fear that they're going to hurt themselves. And once the pain's relieved, you don't have that fear and anxiety, so you're able to go further than you were before, right?
Right.
Is that what you found?
Yes, definitely.
I mean, I don't want to put words in your mouth.
No, definitely.
You
there
tell
was
us.
pain. It's like I can do things I did before. I just don't have the pain there like I did before.
Are you glad you did it?
Oh yes, I would definitely do it again.
So it's a four level fusion, and you can essentially bend over and move, touch your toes. You can extend and laterally bend.
Yes.
I'm happy for you.
I'm happy.
All right. Thank you. Thanks for letting us take care of you.
Yes, thank you.